First this evening, we are keeping an eye on your health as Florida is now one of the nation's hotspots for flu cases. You're watching 10 Tampa Bay at 6. I'm Courtney Robinson.
And I'm Dave Wagner. The last week, emergency room visits for the virus have shot up nearly 30% nationwide. Take a look at how Florida compares to the rest of the country. We're one of the highest, and compared to the rest of the state, the Bay Area is seeing cases on the rise. It's a trend that typically happens in January. And 10 Tampa Bay's Asha Patel joins us right now from outside a St. Pete Urgent Care.
And Asha, lack of flu vaccines, especially in our kids, is a big reason why this is now a February problem.
Now, there are two flu strains that are going on right now, H3 and N1. H3 is a common one. It circles around every couple of years, while N1 has been around since 2009. It's that 2009 pandemic strain, and it still lingers on tonight.
But we're seeing a lot of kids with influenza using hand sanitizer.
Dr. Juan Dumois with the Johns Hopkins All Children Hospital says there's a reason for that.
Very few of the kids have been vaccinated against the flu.
And it's not just the kids.
Just checking the respiratory data, and the flu is pretty much all of it. COVID is very low. RSV is still impressive, but it's low. It's down from where it has been. It's just all flu.
Dr. Jill Roberts is also seeing people of all ages skipping the flu vaccine.
I hope folks will just pass on the flu shot, but will seriously think about getting it. And I do hear people saying, well, but I don't get the flu. Well, that's even more reason why you should get it, because if you're not getting the vaccine, you're not getting flu, you have no antibody at all. And so as more strains come later on, you're going to have zero protection.
Both Dr. Dumois and Dr. Roberts said the flu can hit hard on two vulnerable populations, young kids and the elderly.
Children under 1 or 2 years of age with the flu are as likely to end up in the hospital from the flu as the people over 65.
Now, both doctors tell me that if you haven't gotten your vaccine yet, you still have time, but remember that it takes 2 weeks to kick in, so remain vigilant. Wash your hands and cover your coughs. Now, I'm reporting live in St. Pete. Asha Patel, 10 Tampa Bay.